Hey, hello everybody. This is Sherry with the CGH Health Foundation. Welcome to our program. Dr. Bird's going to be with us in just a minute, but this week is also one of our Growing Healthier programs where we feature speakers on all types of important health issues. Today's speaker is Dr. Song from the CGH Urology Department, and she's going to be talking mostly about bladder function and more specifically about some new technologies that can help you deal with an overactive bladder. Dr. Bird's also going to be our interview for the program, and I think he's going to do a quick COVID update. I want to tell you about our upcoming programs for January, February, and March, because we're going to be featuring some of our newest providers and their fields of specialty. So look for Dr. Al Sayed from Oncology on Thursday, January 20th, Dr. Kiso from Cardiology on February 17th, which is Heart Month in February, and then Dr. Al Zubi from Gastroenterology in March, which is Colorectal Cancer Awareness Month, and that program is going to be on March 17th. All of these programs are presented live on our Facebook page at noon on the designated date. So please make sure to like the CGH Facebook page, and so you'll get notification about that. And if you don't do Facebook, you can find most of our programs on the YouTube page, CGH YouTube page, and there's a link for that on the CGH website. So I'll go ahead and turn it back to Dr. Bird.
Well, thank you, Sherry, and good afternoon, everyone. Thanks for joining our broadcast. So here's how the day is going to go. I'm going to be interviewing Dr. Young Song, our urologist here at CGH, about overactive bladder. And then when we get done asking Dr. Song some questions, then I'm going to do a COVID update with I have some information that's new and things are changing. So I'll give you an update about COVID after we're done with the interview with Dr. Song. So without further ado, let's get Dr. Song here in our interview room. Hi, Dr. Song.
Hi, Dr. Bird.
So Dr. Song she knows this Facebook Live stuff. I think you've hosted this for me, haven't you?
Yes, I got to host Dr. Riley.
Yeah, yes, you've hosted it. And then I think I've had you on as a guest at least once. So welcome back.
Thank you.
Yep. You're always a favorite of the folks who get a chance to watch this broadcast. So glad you could join us. And as always, for those who are watching, just send us your questions and we'll do our best to answer them throughout the course of the broadcast. So without further ado, you ready for some overactive bladder questions, Dr. Song?
I'm ready.
Okay. So what exactly is overactive bladder?
So overactive bladder is not a disease. It's actually a symptom complex of urgency and frequency, and sometimes incontinence is in there. So we rule out other problems like an infection or other neurological issues if you've had a stroke or MS. But if you have basically symptoms of frequency and urgency, you can be labeled as having overactive bladder.
Okay. What do you mean by urgency, just for the folks who are, what is that?
Sure. Urgency is like the inability to hold that urine. Basically, you have to urgently stop what you're doing and get to the restroom. You may be at a meeting, or you may be driving, or you may be at the movie theater, but you just have to drop what you're doing and have this strong urge to have the strong desire to go.
So you go early, you go often.
Mm-hmm. Yes.
Okay.
And when we say frequency, like anything greater than 2 hours, like if you can go 3 hours, 4 hours, that's not frequent.
Okay.
But some patients that really suffer from OAB symptoms would be going every 30 minutes, every hour, every hour and a half. They wake up so frequently at nighttime. So those would be like more frequent, often voids.
Okay, got it. Very good. So there's different ways to pursue these questions, but I'm just going to start on the medicine side. So can you kind of just, for the folks who are watching, what are some of the medicines that you tend to use for this, and how do they, what are the benefits, and then what are the side effects of those medications?
Yeah, so medications are second tier treatment options. And so
okay, well, I'm gonna pivot then. What's the first tier? What would be the
first tier? Would be behavioral modification, and that includes pelvic physical therapy. Okay. So the coffee drinkers really hate to hear this, but coffee unfortunately has caffeine, and that is a strong irritant for the bladder. But it's not just coffee, it's soda or any kind of energy drink. Any kind of caffeinated drink has the ability to prematurely contract your bladder. So that causes that urge, and that causes that earlier than desired need to void. And so if you can limit, instead of drinking like 3 cups of coffee, like cutting it down to 1, or avoiding too much caffeinated drinks like that. And then we really recommend pelvic physical therapy. Pelvic physical therapy is something that CGH offers, and for urgency, frequency, incontinence, I strongly recommend trying pelvic physical therapy for behavioral modification.
Good. Dr. Song, if you could hold your dragon a little closer to your face, they're saying they're getting a little feedback. Just
yeah. Is this better?
Yeah, we'll keep working on it. They'll let you know. But so speaking of pelvic therapy and stuff, we do that here at CGH, right?
Yes, we have Pam here. She's really a great resource for our patients here.
Okay.
I've had great feedback.
Yeah, yeah. So they'll come to you. They'll definitely have overactive bladder, and your first line of treatment is to say, hey, back off on the caffeinated stuff, the carbonated stuff, and hey, by the way, we might have you see Pam and have her work with you to see if we can get you better.
Yes. Mm-hmm.
Right. What's second line?
So then the second line is medication.
Okay.
And so typically there's 2 categories of medications. We have what we call an anticholinergic, something like oxybutynin or ditropan, something that's been around for decades.
Yeah.
We have that class of medication. There's Vesicare, Sanctura, Enablex. There's a lot of medications in that category. And then we have our newest category, which is a beta-3 agonist, which is Mebetric. If you've heard of Mebetric or Mebegron on commercials.
Yeah.
So they both try to relax the bladder so that the ability for the bladder to store more urine is more successful. Store and hold the urine too, if you have any leaking issues, actually.
Okay. So the bladder can fill up more. And what's the downside of the older medicines and then this newer medicine that you're talking about, Dr. Song?
Right. So the side effects very commonly are dry eyes, dry mouth, and constipation. Unfortunately, the way the medication works, it can certainly react with other like mucosal areas. And so if you have dry eyes, we ask you to try to manage it. It's not a reason to stop the medication, but if you can manage with eye drops or try to a bowel regimen for constipation, that would be recommended. But if the side effects are really intolerable, then you've basically failed medical treatment.
Sure.
The other category of medications would be like something like Mebetric. They fortunately do not have those side effects of dry eyes, dry mouth, constipation, but it can have concerns for slightly increasing your blood pressure. And if you are on some cardiology medications, we do want to make sure that there's no interaction. They have shown maybe a slight increase in a UTI with Mebetric, but overall, these 2 classes are actually well tolerated overall, and I highly recommend trying the medication if OAB symptoms are really bothersome.
Sure. So the newer ones have fewer side effects. My guess is they cost a little bit more.
Yes, insurance. Yes, of course, insurance is always an issue with the cost of brand name medications versus generic.
Yeah, for sure.
Mm-hmm.
Okay, good. And then what's the third line that you would say, hey, let's try this for your patients?
So after medications, we have procedures that we can offer the patient. Number one is, if you've heard of Botox injections, we inject Botox into the lining of the bladder. That is an office procedure, or if it's not tolerated, we can go to the OR for that. That's something that lasts for about 6 months. So it's basically 2 injections per year. The other category would be neuromodulation, where we have something called urgent PC. It stimulates your tibial nerve in the ankle. And so you come to our office for 1 treatment every week for 30 minutes, and it's for 12 weeks. So you're committed to coming to our office for about 3 months.
Okay.
And then that also helps to calm down the bladder so you can, decrease urgency, decrease frequency.
Okay.
And then my favorite procedure here is something called sacral neuromodulation. So we have been offering Exonics, and in the past we've also offered InterStem. These are the two companies that offer sacral neuromodulation, but it's like a small lead that gets implanted around the S3 nerve root,
Okay.
and it constantly stimulates that nerve root to help relax the bladder and help it store the urine.
S3. So where exactly does it get implanted, Dr. Song? S3 is the.
It's actually, if you think of your back, it's right above your tailbone. There's a bone that's like a triangular shape, and in that third hole, there's on the left or the right, it gets implanted there. So
Okay.
if people are familiar with a pacemaker, you know that the pacemaker is implanted and it stimulates your heart to contract in a regular beat. That is what we're doing basically with the bladder, and so it's a really amazing procedure that has helped a lot of patients, and even with their bowel issues with fecal incontinence as well.
So, and it has to do, I'm assuming, because that nerve root affects how your bowels and your bladder work.
Yes, it does. The same nerve stimulates your urinary and bowel sphincter, and so we're stimulating the nerves that it's in the pelvic plexus, and so it stimulates those organs right there in the pelvis.
Okay. Yeah. And it's just just has a kind of a frequency that it's going to send out and stimulate that nerve, and that's going to take care of this issue.
Yes. So it's constantly stimulating in the background. So once you have, just like a pacemaker, so once you have the implant, it's with you all day. And so it really regulates the patient's bowel habits and urinary habits. So it is more, it's obviously a permanent fix to something like compared to the urgent PC, which is a treatment once a week. And so it's a little bit more involved.
Sure. How long does the battery last for?
The Exonics battery lasts for about 15 years.
Oh, that's a pretty good time. Pretty good time frame.
But the battery, just like our cell phones, it has to be charged. So it gets charged about once a month, or if you want to decrease the charging time, you can do it every like maybe 10-15 minutes every week, or maybe about 30 to 40 minutes, I think, once a month.
You do it at home?
Yes, you have the whole kit at home. You have a belt that you wear over where the implant site is.
Yeah.
And it's like Bluetooth technology. I think it charges right over your skin.
So you charge your phone and you charge your sacrum at the same time.
Yes, exactly.
All right. So, I'm sure if I had that problem, it would be very interesting. So what would be the downside? Who are the patients that qualify for this, and who are the patients that maybe wouldn't qualify for this?
I would say the downside of any procedure would be the risks, and the cost. So any procedural risk has bleeding, infection, pain, that kind of generalized risk. But this is actually a very minimally invasive procedure. It is an outpatient procedure. And so the patients that would qualify for this procedure would be somebody that's really symptomatically bothered by their overactive bladder symptoms, because overactive bladder is not life-threatening. It's actually a quality of life issue. Okay. So as much as you're bothered by it, that's how much we would like to, to work with it. So if someone's not bothered by it, then, this is not obviously for them, but this is for someone who's really, their life is really impacted. They're not, they're not enjoying social activities. They're not really leaving their house. They're trying to basically live their life around the bathroom. So those patients would be great candidates, especially if they've failed medications, then this is something that they can consider. Sometimes I have patients try Botox, try urgent PC, and try sacral neuromodulation. Sometimes you need to kind of do a little bit of experimenting to see which treatment is best. But I would say there's not many people that aren't candidates for this. And a great thing about this is that the first The first procedure, we actually put in a temporary battery and they try it out. They get to trial it for 1 week.
Okay.
And if the symptoms improve greater than 50%, then they come back the next week, and that's when we place the permanent battery.
Okay.
And
So you know right away if it's going to be helpful.
Right. So you're not going to implant a permanent battery if it's not working for you. So.
Okay. Yeah. And Donna's asking, if you have lower back pain, is that surgical procedure not a good idea? What would you say about that, Dr. Song?
So that is actually, I've had patients that have had low back pain and they've had spinal work. So the sacrum is where basically your buttock is. So imagine your underwear area, that's where the implant would be. So it's actually not related to the low back. So I would say that low back pain does not exclude you from this procedure.
Okay. I'm guessing that insurance companies are going to say you need to do steps 1 and 2 before we'll do steps 3.
Right. Mm-hmm. Right. And that's how we would go with the algorithm. We would never jump to this. This is a great procedure, but it's really, I think it's great because the patients that have failed previous treatments actually can have a great response. And that's why the improvement can be kind of dramatic, actually.
Yeah. What does the research say? What percentage of patients do have improvement after they have this procedure?
At this time, you can easily quote 80 to 90% can have improvement.
Okay. Yeah. Linda wanted to ask, you can see the question there, Dr. Song. What would you say to that?
Can Coumadin or TP medicine or having elevated creatinine give 7 months?
Let's try to break that out. So if you're on a blood thinner, how do you manage that?
If you're in terms of overactive bladder or this procedure?
Well, for the procedure itself.
Right.
So if you're on a blood thinner, how do you manage that for patients?
We're going to hold the blood thinners before our procedure.
Yeah. So you'd make sure you'd have them hold, and then you'd have them start it back up when the procedure's done, right? Okay. I'm elevated creatinine nitrogen. I'm going to say, let's say your creatinine level is elevated. Let's say your kidneys don't work quite 100%. Is that a reason that you wouldn't have this procedure done, Dr. Song?
No, it wouldn't. But if you have some concerns about your kidney, of course, we would check a kidney ultrasound, make sure there's no obstruction, and make sure you're not obstructed before we put this in. And so we would make sure we've checked up your kidneys before doing something like this.
Okay. Yeah. And thanks for the question, Linda. We're trying our best. If you wanted to give a little more information about the second part of that question about drinking more water, we can try our best to answer that. Good.
I'm going to comment on that, actually.
Fire away.
Because patients are always told to drink more water, right? And I think that I agree. I tell my patients to drink more water too, especially if they have UTIs or kidney stones. But they should drink more water in the morning and in the afternoon, not at nighttime. Because I find that patients will continue to drink towards the evening hours, and then they will have more frequency, like, when they're sleeping, they have to wake up at night, that kind of thing. So I would say try to time your drinking early in the day.
Yeah, that makes sense, because overactive bladder is no fun during the daytime, but particularly if you're wanting to get sleep, that's when quality of life can be affected more so.
Right. Yes.
Yeah. Unless you have to go to the bathroom at Walmart and you don't really want to do that, and you're like, I have this overactive bladder. Donna was asking, a 70-year-old woman, how many times is going to the bathroom during the night too much, but can be held?
So anytime you wake up less than 2 or less times a night is still considered what we call normal. So if you're waking up 3 times a night, then we should look into that. But even 2 times a night, people don't want to be waking up 2 times a night. So I would say, again, right there, you would want to look at your lifestyle. So are you drinking fluids after supper? That's another reason to be waking up at nighttime. And of course, your medications and but 2 or less is considered somewhat normal.
I'm jumping around a little bit. Oh, Carrie wanted to ask. She wanted to say, okay. I think that's a big thumbs up for you, Dr. Song, and and for that medication too.
Yes. So. when we have patients that are happy when it works, it's great. Mhm.
But I do want to, I'm kind of bouncing around here, but you said something that I want to go back to for the first step was this physical therapy side of things. So is there, for some people, can they do bladder training where you say, okay, look, I know you feel like you have to go every hour, but I want you to wait for an hour and a half for a week. And then I want you to wait for 2 hours for a week. And will that, for some people, actually get them to a decent place?
Yes, I think that there is that mind over matter concept. And so the bladder loop is intimately controlled by your brain. And so if you have certain associations and you can try to change those associations, yes. And so you could do bladder timing, so, okay, I've gone 30 minutes now. I think I can go 45 minutes, or I've gone, an hour and a half. I'm going to go an hour and 45 minutes, that kind of thing. So yes, you can push yourself to do bladder training. So that's, again, something that Pam would work with you on
Sure.
as well.
Sure.
And Pam also has more like behavioral modification. You can actually have biofeedback. And so you can kind of see what you're doing. If you're trying to relax or tighten your pelvic floor, you can see that happening as well.
Sure. And bouncing around a little bit, just from a practical standpoint, to get in to see you.
Yes.
If they could get in to see either you or Kevin, are you still going to get the same sort of information and begin that same step process? If you know what I'm saying?
Yes. That's where we always start. We just ask a good history in terms of what's happening, what's causing it, when is it happening. And then also the patient has their primary care doctor that they've also worked with. And so maybe they're already on the medication. And at this time, we would talk about third line treatment options. Pelvic physical therapy, again, is a great resource. And if it's not being utilized, I would certainly go back to it and say, have you tried pelvic physical therapy? Or would that be appropriate for this person? And so we would just go through the same steps. Mm-hmm.
Okay, good. Anything else that you thought I was going to be asking you, Dr. Song, that comes to mind? Oh, Linda, I want to ask, is there bladder tracing available?
Bladder tracing. I'm not sure.
Can you be training?
Oh, bladder training. Yes, bladder training is available. Just kind of, we can talk about, Pam has been great with that. And so that's where I would like to refer the patient to pelvic physical therapy.
Yeah, good. Anything else that you has come to mind during our conversation that you wanted to add, Dr. Song?
Well, I think that overactive bladder is a very common issue for a lot of patients, especially as we get older. So it's something to talk to your doctor about if it's certainly bothering you. But if it's not bothering you and you have some occasional frequency, some occasional urgency that's managed, it's not necessarily a problem. But when you see that it's impacting your life, you're avoiding going out, you're trying to stay home, or you're going through a lot of pads, you're using a lot of Depends combo pads, I think then you definitely want to talk to your doctor or come and see the urologist, of course. Okay.
Good. Well, Dr. Song, thank you for taking the time to answer a few questions and about overactive bladder. It's always nice to have you on here to answer those questions.
Well, thank you so much. It was a pleasure to talk to you.
Yeah, thank you. And I bet you we'll have you back again.
Okay.
Well,
happy holidays.
I'm going to hit you up again. We're going to have that something else we're going to talk about, so.
Well, yes. So Merry Christmas.
Yeah, Merry Christmas to you too. All right, thank you. All right, always nice to have Dr. Song on. So, okay, that was overactive bladder, and I wanted to give you some more updates about COVID and the pandemic situation too. So Matt's going to put up our usual facts here. So this was the update this week from Whiteside County. And red is this week on the top bar there, the top part of the top graph. Red is this week, blue is the week prior to that. And then you can see the age groups broken out as well, which fits with what you're probably hearing from your friends and neighbors and on news shows and stuff like that. We definitely have more cases now than we did even a few weeks ago, and that's affecting schools and those type of things. And then the bottom graph is the past 2 weeks prior to 2 weeks prior to that. Okay, what other we want to show folks here, Matt? Yeah, so this just gives you the every day we get something from the health department, and you can see Monday, Tuesday, and Wednesday. And if you key in on the Whiteside County positivity rate, running around 7.5% compared to the state rate of about 5.5%. And the cases, Mondays is a little bit skewed, I think, in terms of the cases by the weekend. But, I would say that Tuesday and Wednesday are fairly representative of what we're seeing lately. So definitely trend upward. And if you see the bottom right, where my kind of, the bottom left graph, the chart of the number of cases, you can see once again where we're trending right now in terms of number of cases. And yeah, it's just a different surge right now because, typically we would have back like when this all kicked off in like that August timeframe, and then it looked like it had peaked. And I don't have my glasses on, but it looked like it had peaked like in September, October, and was going down, and not so much now. So thanks, Matt. And I'm going to break into a little analysis on that. My sense of that is it's a combination of things. It's for some, first of all, you still have unvaccinated folks who are getting COVID, and even unvaccinated folks who had a previous infection that maybe Delta is getting them sick again. And then you have people who are vaccinated with, let's say, 2 of the Pfizer or Moderna vaccines, but it's been last January or February or March, and we're getting more of those breakthrough infections, definitely with Delta. And then you have on top of that the fact that people, it's been 2 years since this really kicked off in China, and close to 2 years coming up in March when it kicked off here. And so folks, as they go about live their lives, are a little less, in general, I think a little less willing to, able to, whatever you want to say about behaviors and how they go about doing things that would protect them from getting sick too. So it all adds up, and I think that's what we're seeing. So those are those facts. I wanted to give you every week, every day, I get something from the IDPH about the number of hospitalized patients in the state, and that's trending up as you might anticipate. Yesterday was 3,105. We had 284 patients on ventilators in the state, which is also up from where we were at a few weeks ago. The good news is the number of people getting vaccinated was up to 71,745 every day on a rolling 7-day average as of yesterday. And that's really good. I mean, we were at the 40 some, maybe as high as 50 some range a while back. So it seems that as we get more cases, people tend to say, oh, okay, well, I better get in my booster or whatever I need to get. So that's up to 71,000, which is encouraging. Where are vaccinations for children available? Is Moderna, Pfizer better for young children? So Donna, let's see, vaccines for children. I know the health department is doing them, and then our pediatrics department is doing them on a scheduled basis, certain days of the week as well. So those are at least a couple options that I'm aware of. And I think retail pharmacies are doing those as well, Donna. So yeah, there's a lot of options. I will say though, and this is I wish we had more access. We just have a shortage of healthcare staff, but right now there are more people who want booster shots and or regular, starting their shots than we have people to give them. So there's a little bit, I'm told there's a bit of a lag between when you'd schedule and when you can get that done. So if you're thinking about it, get online today and get that scheduled, because it might take a little while. Anyhow, I know that's definitely an issue. Other news that I would throw out there, this has kind of been confirmed, but I know early on convalescent plasma was proposed, it was kind of thrown out there as, hey, we can give people who would already have the infection and give their blood to people, their plasma to people, and that will help them. No, that's been finally said. The World Health Organization has said no go on that. You've of course heard about Omicron's newer variant that started in South Africa, and definitely it's concerning. I know I was reading where South Africa now, that's it's been just a few weeks that it was identified, and now I think it's the majority of cases are Omicron in South Africa. So it's going to be across the globe. It is here already. There was a case in Chicago this past week. And the patient in Chicago actually was a patient who had a booster shot even. So it's Omicron's going to become thing, but Delta is still the biggest one right now in this area. Pfizer did a lab testing on this Omicron and looked at how people in the lab, how people who have been immunized, how it affected them. And if you've only had 2 shots, Omicron, people responded with about 25%, 25 times fewer antibodies if you've just had 2 shots to this virus compared to the Delta or other variants. However, if you've had a booster shot, the antibody response to the Omicron for the Pfizer shot, this was in the lab, was about the same as it had been after 2 shots for the previous strain. So that looks encouraging. Obviously, we're going to find out now more information in the next few weeks. Also, the Omicron mutations, when Pfizer did some work in the lab, didn't seem to affect how T cells work, which is another form of immunity. So the hope, and this is still not a done deal, is that, first of all, if you've had 2 shots, even with an Omicron type of variant coming into play here in the very near future, that those 2 shots may still prevent really getting really, really sick. And it looks like, although it's not a done deal, that if you've been boosted, that that is going to be pretty helpful in terms of getting really sick from Omicron. It's looking that way now. So other news, in addition to Delta and Omicron, we're seeing flu come across the area now. We're starting to get cases of influenza in our community. And so once again, if you haven't had a flu shot, get a flu shot, because a flu shot kind of has always worked more along the lines of, it may prevent infection, but it also will prevent you from getting quite as sick as you might otherwise with the flu. So it may not prevent flu, but it can prevent you from getting really sick from it. We continue to have a booster clinic here, and the booster clinic or booster or any sort of vaccine, if you want to get your first or second one, we are doing it here at CGH in the main clinic. And we've actually moved that clinic to the old coffee shop area. So you can just walk into the atrium, and right there where the coffee shop is at, where people are waiting, and they go into the coffee shop to get their shot. You have to schedule that. We ask that you schedule it because of the demand right now, but that is ongoing. What other news? So this is related to COVID indirectly, but I think it's important enough just to mention it, is that we are seeing that particularly young adolescents, that mental health wise, we're seeing some significant issues with mental health for them. I saw an article, I forget where it was published in, but in early 2021 for adolescent females, there was a 51% increase of them showing up to emergency departments with suicide attempts. Only 4% for adolescent males. But mental health wise, it's all of us. It's an issue, but particularly for the young. And I wonder a little bit if you're coupling, the social interaction part of things to and along with the fact that some of the social media that the young are using cannot be helpful in terms of their mental health as well. So I guess I'm going to kind of go into opinion on that for everyone. If you're having mental health issues, seek care and get mental health help sooner rather than later. Get fully vaccinated, and then once you've done that, live your life. Other than if you're indoors, I'd wear a mask, but unless you're eating, but I'd go ahead and try to do your best to live your life. I think I'm going into opinion here. On one other news thing I wanted to mention, this is also part of an indirect effect of the pandemic, is this was in 2020, but colonoscopies were down 45%, prostate biopsies were down 29%, lung CT screening tests for lung cancer were down 10%, cystoscopies, which are kind of bladder scopes, were down 21%. This was published in the journal Cancer. So point being that folks in 2020 definitely were not seeking out as much of the preventive medicine care. I sense that people are doing it more in 2021, but please, if you have medical issues, if you have screening tests that you would typically need to have done, please do them. Don't let what's going on right now with the pandemic keep you from doing that. So yeah, I just encourage folks to do that. So a couple other points, and this, I'm going into the opinion side of things here. I know the CDC still says that fully vaccinated definition, I'm pretty sure, is just those two first mRNA shots or the J&J shot. I think you're reading this, and I'm telling you that Bill's definition of fully vaccinated right now is a booster shot. So I wouldn't, for myself and those that I'm talking to right now, I wouldn't consider myself fully vaccinated until I've had a booster shot. So really encourage you, and booster shots now are for anybody over the 18 and up can get a booster shot, and it's recommended. So please seek out and get that booster shot. If you have 2 shots, your likelihood of being hospitalized is way lower than if you're unvaccinated. Don't get me wrong; it's still protective in terms of keeping. We have far more folks who are unvaccinated or hospitalized and get really sick than people that have the 2 vaccines. But just why not add that extra layer of protection? Get the booster shot, and that brings you much closer to where you were at, a month or so or 2 months after you had those first two shots. So that would be my recommendation here. And beyond that, though, after you've gotten your booster shot, I live your life, wear a mask if you're inside, other than if you're eating food or something like that, and go about your normal days. And it's been going on for close to a couple of years now. So I think if you're doing that, you can kind of try to continue to stay in the stream of life with that extra protection, with wearing a mask and getting the booster and going about your business. So I'll keep coming back, and we'll have another get together next week. And until then, I hope you have a great week. Hope you have a safe week, and we'll talk next week. And thank you for tuning in.